Hi, my name is Caitlin Wilhelm, and today I will be presenting my capstone presentation for 4th semester of Nursing 245 class. During my nursing school experience through Bridge Valley, I've done several clinical rotations at various places, ranging from intermediate care to obstetrics. By far, the unit that I have spent the majority of my time on would be 7 South at CAMC General. This is an intermediate care floor, and it's a 35-bed unit with a nurse-to-patient ratio of 1:4 or 1:5 depending on acuity level. They provide care to those needing telemetry monitoring, critical med IV infusion, transplant patients, and the general medical patient population. They staff registered nurses for the more critical care patients, licensed practical nurses for the more stable, and unlicensed assistive personnel to assist with client self-care, monitoring vital signs, and if a patient would require a sitter during this time. For my first program, student learning outcome, I'm going to talk about is human flourishing. This is when you advocate for patients and their families to promote self-determination, integrity, and ongoing growth. When it comes to advocating for patients and their families, I had a patient that presented multiple times over the course of a month. This patient had a history of uncontrolled diabetes, hypertension, and was unable to self-care due to limited mobility, and stated that he had no family nearby to assist. I advocated for my patient by getting home health involved to help the patient with his extended care needs. I also explained to this patient how to watch for signs of infection and to keep wounds clean and dry the best that he was able to, and made sure that he had a phone number for his home health nurse if any trouble arose. My next program student learning outcome is nursing judgment, where nurses use their critical thinking to generate safe, effective, and efficient patient-centered care. I have taken my previous knowledge that I had gained early on and extended on that when I had a patient present with the only complaint, a dry and nagging cough. When overlooking this patient's medications, I noticed he was taking lisinopril. I asked this patient if he had been taking it for a while, and the patient stated it was a newer medication that the doctor had previously prescribed him the month prior to. I spoke to the physician and that the patient would be seen that day and notified him of the newly prescribed medicine and stated my theory was the medication was causing the naggy cough. However, they did do a chest x-ray to rule out any nodules to check for possible cancer or any other underlying condition. That did come back negative. The patient at the end of the day was switched to an ARB, and the patient had came back a month later as a follow-up and stated that the cough had went away. For my next student learning outcome, I will talk to you about spirit of inquiry, where I integrated current best practices to plan and implement safe and effective patient care. For all my clinical rotations, I implemented best practices with safe and effective patient care by turning patients every 2 hours at a minimum, and when bathing or assisting them to the restroom, assess for any new problematic or arising skin issues such as blanching, skin tears, ecdysis, new or worsening ulcer formation. If anything appeared concerning, I would report this to my nurse or charge nurse, assist with addressing the area appropriately, such as Duoderm or bandage or whatever was needed at the time, and notify this during shift report as well, using S-bar formation. For my final student learning outcome, I'm going to talk to you about professional identity. This is where you implement your role as a nurse in ways that reflect integrity, responsibility, and ethical practice. As a soon-to-be graduate nurse, there are things that during my nursing school experience that made key concepts more concrete. It is important in the nursing profession to practice competently and with integrity. And by choosing a career in nursing, you are to uphold the code of ethics. As a citizen in society without medical background, you are not obligated to help another in need, such as during a motor vehicle accident, but as a nurse, I am required. Generalized citizens are not required to be non-judgmental toward others, but I'm held to a higher standards to put my own beliefs aside. When entering this career, I was well aware of the many risks that come with the job, but I feel the rewards greatly outweigh those potential risks. In conclusion, when I obtained my LPN license back in 2013, I was of course brought into real-life situations and was trained on how to handle those situations. Once I started back to school to work on obtaining my registered nurse degree, I took my previous knowledge gained and have learned so much more. It has brought all of the different disease processes that I may have had little to no experience with before and have now tied it in with all the pathophysiology, key signs and symptoms, and has made me a much better nurse. With all of this expansion on key concepts and processes that I have obtained will provide me with all of the tools that I need to be successful with my ultimate goal of passing the NCLEX for RN.